So we've got quite a full session. I know that more people will be joining the session, and we are recording it. So I wanted to say a huge welcome to everyone for joining our webinar this afternoon. I'm really delighted that we've got Annie and Sol with us, and we'll be doing proper introductions shortly. So this webinar is a really important webinar, listening to patients and staff, an integrated approach to improving quality and safety. I'm Martine Price. I'm the clinical nurse lead with Improvement Cymru, and really delighted to be helping navigate chair through this session today. As we will have, I can see the numbers are going up in terms of people joining the session. Please use the chat box and welcome questions. I know Annie and so will welcome questions, so pop them in the chat box. I'm sure there'll be time at the end, Annie, to pick up questions, which would be fantastic. So before we dive into Annie and the session, I'd like to introduce Professor John Bolton, who's our National Director for NHS Quality Improvement and Patient Safety, and the Director for Improvement Cymru. John, thank you.
Thanks, Martine. Good afternoon, everyone. It's great to see some familiar faces, and it's great to see some new faces on the screen as well. So forgive me, right on cue, my dog is barking in the background. So if there's noise in the background, I apologise, but he does find a way of doing this every time we do one of these webinars. So welcome to this afternoon's webinar regarding listening to the needs of patients and staff. Now, I've no doubt that you're going to really find this session really engaging and give us all really a lot of food for thought as we're starting to think about how we all work together as we start to come, fingers crossed, touch wood, out of the pandemic, and we start to actually think about getting back to some form of normality and business as usual. So it does give us a bit of an opportunity to actually think about how we can feed some of this work in going forward. So for me, business as usual is restarting some of the national improvement programs, and I'm sure for a number of you is starting to actually restart some of the improvement as well as driving improvements within your organisations. But I think, also recognise that this is at a time when the healthcare system, the staff within NHS Wales are, really quite tired, and we're asking them to start to rethink about how they drive improvement. But look back over the last 18 months of what's happened in terms of driving change, driving improvement within Wales and within the UK, and just how amazing the staff that we've been working with have actually been in driving not just change but improvement rapidly to actually help and support with the COVID crisis. But it's been clear for a number of years, but certainly reflecting back over the last 18 months, it is really clear just how important staff engagement, staff experience is to actually driving improvements forward. You've all heard of the triple aim as a result of staff engagement, staff experience becoming much more prominent. The triple aims now become the quadruple aim, with staff engagement and experience holding equal weight to patient experience. And I think a lot of us would recognise, a happy staff experience will almost certainly reflect into good patient experience. So absolutely essential that we have the two going together. And whilst at the same time is also thinking about measuring and using staff experience data in meaningful ways to support the improvement as we drive it forward. So I'm not going to carry on. I'm going to introduce Annie, who is going to take you on the next hour's session in terms of helping us just think through staff experience as well as patient experience. So Annie's got the fantastic title of Chief Experience Officer at Northumbria Healthcare NHS Foundation Trust. It's really great to have you on the call, Annie. So thank you so much for your time and support with this. So Annie's really, and her team is really at the forefront of driving forward both patient and staff experience within organisations. And I think, we're going to spend the next 45 50 minutes listening to Annie reflect on her own experience, but also the experience within Northumbria. So with that, I'm going to hand over to you, Annie. Welcome. Thank you very much for your time, and thank you, Sol, for helping and supporting today.
Thanks, John, and a real privilege for John and Sol and I to join you. I'm going to run this workshop in two parts, really. So the second workshop that we do is going to focus on what is a decade's journey, a story really of how we've worked to understand and change patient experience within Northumbria Healthcare. But today I'm actually going to start with a more current story around how we support staff experience, and particularly some of the learning around supporting staff experience through COVID. So Sol, can you pop up the slides, please? And I'll just take control. So as John mentioned, my role is Chief Experience Officer for the Trust, and that means I have equal responsibility for understanding and improving patient experience and staff experience in equal measure. And we don't separate that from our approach to quality going forward. It's an integrated part of our improvement approach. So this, I know you've done some work with Michael West in Improvement Wales, and I use this quote a lot. I've had the privilege of being in the NHS for 30 years now, and the deep privilege of spending time with people at key moments, certainly at key moments in their lives. But the bulk of Michael's work really reminding us that staff experience precedes patient experience. If what we want is safe, compassionate, and effective care for patients, it can only come from a workforce that themselves feel well-trained, confident, competent, and safe themselves. And sadly, there's a lot to do to improve staff experience in the NHS. We know, and this is pre-COVID figures, so these are quite shocking statistics from 2019, that 1 in 11 people are choosing to leave the NHS permanently every year. A significant proportion of us very frustrated that we can't provide the level of care that we'd wish to. And that levels of sickness in 2019, the highest level recorded for the last 5 years, more than any other industry, with 40% of staff reporting that they felt unwell due to work-related stress. And we know that also there are groups of our staff that are particularly disadvantaged in this regard. So Black, Asian and minority ethnic colleagues far more likely to be subject to the worst conditions of all. So I'm going to start by asking you a question around how are you really? How are you feeling? I want you to immerse yourself in the Northumbria experience. We're just going to check in with you this afternoon. I wondered if you can click on the link, which is the Northumbria Voice, and it will ask you a question around how motivated you're feeling for work today. You have to probably scroll down the whole screen in order to submit your answer. If you want to give us a score out of 10, and if you want to give us a comment about why, feel free. But if you can all do that now, that would be great. You can either use the QR code or if you can't access via that link, I know Sol will have shared the link in the chat for you. I'll just give you a couple of minutes to do that. If people don't want to leave qualitative comments, you don't have to. You can just press skip and submit. But if you want to tell us why you're feeling like you are, then that would be great too. So Northumbria Voice was a platform we developed just before the first wave. I'd been working with Northumbria University to look at different use of technologies for engaging staff in different ways. And it gave us a real-time opportunity to link in with staff every day and to take stock at the end of the week of exactly how people were feeling, and to feed that information critically through daily meetings that were happening through gold commands so that we could act on the fears, the concerns that were raised by staff, as well as keep doing the things that would help. Okay, if you've had an opportunity to do that, I'm going to move on to the next slide. So in 2018, I had a conversation with my chief exec, which was acknowledging the work that we'd done to improve patient experience, which will be the subject of our second webinar. But I was reflecting that actually the evidence linking patient and staff experience has been around since about 2011, 2012. So we all knew about the inextricable link between staff well-being and the quality of care we were able to provide. And yet I didn't feel that we were doing enough about that clear link. And in my own organisation, I could certainly understand why some staff may felt we cared more about the experience of patients than we did about the experience of staff. So my role changed in 2018. I took on a focus to do similar work to improve staff experience. And this was the way I approached it. I wanted to do a literature review and ground it in the evidence of what works. I wanted that to be based on a number of manageable core domains that we could improve. I certainly wanted to keep that as close to measurement in real time as I could, and I wanted that improvement work to be grounded in the things that staff cared about. So in the summer of 2018, doing that literature review, I was able to look at some of the learning about what it is that successful organizations prioritize in their improvement journeys. And these are the things that you see on the slide, all things that I'm sure we'd identify as being important. I was able to map those themes onto a Joy at Work framework that had been published by the IHI in 2017, about 6 months earlier. And that had given me my handful of domains of evidence-based measures that allowed me to understand staff experience and engagement. So suddenly I had my 8 things I wanted to test, and it tied in very neatly with the 8 to 10 core domains of patient experience that we had been running. I can't underestimate this enough, or overestimate this enough rather. I've had fantastic support from comms and engagement colleagues, and we've learned that if you really make this work visual, if people walk around your organizations and see and feel that the organization cares about staff experience as much as they care about patient experience, then this messaging is really matters. So we went public, we went visual, we went large with promoting our staff experience program. And we called it our year of discovery. We didn't really know where it was going to go, so we wanted to set a baseline position, and this was where we were in December 2018. Now, the scores won't mean very much to you, probably only important to my own organisation, but all I was trying to demonstrate is that for the first time in my organisation, with enough numbers and a weight of that sample size, we could understand at a granular level in the organisation how different teams were feeling in each of these 8 core domains, what was the variation between specialties, between hospital sites, between qualified and non-registered staff, and between junior doctors and consultants. We could slice the data any way we like, but it gave us a much better understanding of what was happening and the mood in the organisation than the participating in the annual staff survey had done every year. So we were delighted with that. We were initially really delighted with the fact that we'd persuaded 2,726 people to respond to that baseline survey, because we thought it would be out of curiosity, and we thought we might peak there and it might be on a downward slope of engagement. As it is, that's been our lowest ever returns. So we have consistently heard from between 35 to 40% of the organisation with each pulse survey, and for an adult survey, that's very healthy representation, really. And because we are getting those numbers, as I say, it allowed us to deepen the inquiry of how staff were feeling in different teams and in different professional groups, etc. We're also able to analyse that data with respect to groups represented by protected characteristics, and that's really important for our equality, diversity and inclusion work plan. So we did some pilot work. We used experience-based co-design as our improvement methodology. I managed the expectations of the board. Obviously, patient experience had done very well in our organisation, and so expectations were high, and I was a bit worried that we weren't going to see the same gains in staff experience that we'd maybe seen in patient experience. And yet, within a year and some pilot improvement work, we were able to demonstrate from what had been a fairly healthy baseline statistical gains in every single one of the 8 domains of staff experience, which was really exciting. We hadn't been expecting that. My literature review had introduced me to this measure called sustainable engagement, and I really like it as a core metric. I use it now in all of our surveys, regardless of the theme of the survey. So we track sustainable engagement in my organisation now all year round. And it's a measure of not just how engaged people are feeling, but how much can organisations rely on that discretional effort for the future? Are people envisaging that they're going to be with Northumbria for a while and continually willing to roll up their sleeves in an endeavour to make the organisation a better place to work and a better place to provide care? So again, all of those measures of sustainable engagement were statistically better within 12 months. We were, again, surprised and delighted. I benchmark everything I can. As keen on benchmarking as I am on using data for everything that moves. So we were able to do some work with the Eye Opener Institute, who are based in Oxford, and they have studied happiness at work across all industries for the last 20 years, and they have an IPPQ survey, which is about happiness at work, and they've got 65,000 global responses, and we could compare the organizational performance and how we were doing against that global average. It showed that Northumbria respondents were more engaged, we were happier, more likely to love the work that we did, and as a result feel more energized, more productive. And those comparisons held true, not just in the health sector worldwide, but also within the UK too. So we were doing a lot of internal measurement and validation against benchmarking that existed for us. And the picture in that first year had been pretty positive. And then the national results came out, and we saw the same lifts in the same areas. We were named Best Place to Work in the NHS in 2019. And of the 11 domains that we were measuring, we were best in class in 7 of them. And we had also achieved the highest response rate in the NHS, which is a sort of a proxy measure of engagement in its own right. So the picture by the end of 2019 was fairly rosy one. We thought we'd had a very considered approach to how we would use pulse surveys to improve the experience of staff, and we had tangible evidence that even in 12 months we were starting to see some traction around that and change for the better, which was exciting. But then, of course, the pandemic happened, and suddenly the notion of asking our staff how they felt every 3 months just felt completely wrong. We had to radically redesign our approach. And I was much keener on getting a thread of information throughout the pandemic of exactly where our staff were at some of the most frightening times in their career, really. So before we think of that, I'm going to ask a question from the group. You're not going to break up into breakout rooms, but I'm wondering if you can use Slido. So use the QR code on the screen. If not, Sol will copy the link in the chat. And we'll have a couple of questions to ask you in Slido. This have been, what's been your experience of staff support during the pandemic? And then similarly, if you could do one thing to enhance the quality of either patient or staff experience in your own place of work, what would it be? So we're going to ask you those 2 questions. I'm going to hand control over to Sol, and he's going to get Slido up for us. If you've got any problems connecting, can you just let us know in the chat?
Does someone need to go on mute?
Yeah, 2 seconds.
So the code for entry to Slido, just hashtag NHS123, and then you'll have an opportunity to just answer the 2 questions. What did support feel like for you during the pandemic? So obviously your responses are anonymous, but they will pop up on our screen. Hopefully we'll start to see them soon. Somebody said that they can't see the question in the slide, so I'll just repeat it verbally. It's what has been your experience of staff support during the pandemic? It could be that some people don't have access to Slido. If it's a platform that might be blocked by some organizations, I'm sorry about that. And what we're getting is variable, and people reporting excellent support, and others where that hasn't been their experience at all. On the whole, I'd say most of this is positive, really, but for some it's patchy and inconsistent, and that some people wanted far more practical help. Felt there was some lip service to some of the support on offer. A very common experience that people got their support from immediate colleagues around them. We'll take a few more and then move on to the second question, I think. So we're demonstrating this just as how easy it was to use a platform. We use Northumbria Voice, but just to get the mood, we were hearing from thousands of people every week. In the first 10 weeks, we heard from more than 12,000 staff. And that was incredibly rich information that allowed us to feed that in on a daily and weekly basis as we needed to escalate concerns on the day that they happened and to address matters for staff. That might be uncertainty about guidance, if they needed more information, the support. We learned that actually it was staff that were shielding at home that were most disadvantaged in terms of their staff experience. And so we changed our welfare calls to be directed and to make more than, I think, close to 1,500 welfare calls home in the end, and send a lot of information home for people that were disconnected from the work site, safeguarding issues, telephone numbers they could ring at times of emergency, and things they could keep on the fridge, as well as creating safe spaces and feeding all of our staff and providing free food and accommodation and parking. Great. So Sol, can we move on to the next question, please, and give people a chance to answer that one? And again, I'll say this out loud in case you can't read it on the screen, but if you could do just one thing to enhance the quality of either patient or staff experience at your work, what would you choose to prioritize? What would you do? Okay. It's more, fill the vacancies would be important from an organizational perspective, and I'm sure from staff expectation, but this is about your own personal responsibility. What can you offer within that? So spending time, listening, showing leadership in terms of ensuring people take the breaks that they need, playing all of the part that we can play in helping people feel valued, and I'll talk a little bit about that in a second. One of our surveys, once we'd analysed the qualitative comments, we were able to identify 7 core themes that mattered to staff, and one of those themes was notice me. And not in a sort of a narcissistic way of notice me. It was just people needed to know that the contribution they were making during the pandemic and everything that they were trying to do was somehow acknowledged by the organization and appreciated. So because of that direct feedback from them, we set up on a weekly basis, who have you noticed that Sol has played a leading part in supporting. So it's a very simple mechanism. We get hundreds and hundreds of names every week. They shared on a Thursday night on our social media internal platform, our staff page within Facebook. And then Sol and the team send out a brief email of appreciation, which details the comment that has been received by an appreciative colleague, so that people have an understanding of why they've been noticed. So really, really cheap as chips, didn't cost anything in particular to implement, fantastically supported by my team, but it has made a massive contribution to staff feeling noticed, appreciated. And on a Thursday night, Facebook goes wild at that point, the minute you post the names, and people still 6 or 7 months in haven't tired of who have you noticed. So sometimes a really simple measure like that making a significant contribution. Okay, so these are great ideas. I'm just going to let them all come in. Feel free to keep adding to them as you go. And we'll share these with you, Martine, so that everybody can have a record of the good ideas from others. But I'm going to move on now, if I may. Okay, so this was our approach to improvement and well-being in the organisation. We like triangles a lot, it seems, in Northumbria. Most of our strategy documents have triangles appearing at some point. But what we were trying to say with this was that our response during COVID wasn't about over-medicalising it. It was almost to give people permission and normalising the extreme emotions that people were undoubtedly feeling. Making sure we had the right level of support for all, as well as the specialist support for those that needed it. And again, we talked about our onion approach, layered approach, that enabled us to provide support across the organisation, which is the outer circle, within teams, the slightly lighter blue, and then the individual support for those that needed it, in particular routes perhaps to clinical psychology or occupational health. And we also took time to connect the organisation to existing support that was being offered nationally as well as locally, to give people the choice of where they went for some of that support. So sorry, that slide's quite hard to read, but again, if you can, I'll share the presentation at the end, and if you can go into the detail of that. The point that I was trying to raise with that it was a very integrated approach. So twice a week in the very beginning, but we had colleagues from public health, quality and diversity and inclusion, staff experience within my team, comms and engagement within Claire Riley's team, HR colleagues joining to come together and say, how do we work together to provide an integrated approach to health and well-being? We set up a website, and we changed the resources. We provided training for managers that were leading through COVID, as well as lots of comfort and source of encouraging people to take breaks. By Christmas, we wanted to show appreciation. So in a Northumbria box, as a thank you, we, in a brown paper package tied up with strings. So if you want to rock your inner Sound of Music, or this was a gift. Now inside the gift were locally sourced items. We were supporting the local communities, but also sending a message of appreciation to our staff, as well as a 50 quid bonus that came in the middle of January, when we thought that Christmas salaries may be being stretched a big thin. And it wasn't just about recognising and who have you noticed, but also celebrating the contribution of staff through our staff awards. All of that was done virtually. But we didn't miss the opportunity to make a huge fuss. I won't forget the week that we sat in gold, particularly concerned that we were just about to run out of PPE. We hadn't had a delivery in 3 days, and then the arrival came, and it was woefully inadequate in terms of what had arrived and what we were expecting. And it was that mother being a sort of necessity, being the mother of invention. It was that desperate need that led to the creation of our own PPE factory. So what started in this top showroom above a car showroom in the top room which we invited business partners. We had local volunteers, seamstresses that just wanted to volunteer to support the NHS. A really innovative and instrumental leader called Sarah Rose, who'd worked in industry and manufacturing, coming together, as well as partner organisations locally in the NHS to create our PPE factory. And we're just going to give you a quick clip from the top room of a car showroom. We have expanded somewhat. Sol, can I stop control and ask you to just play that film? So that factory is massive now. It employs 60 local people. That's jobs that have gone locally from, you know, willing volunteers that just came forward, but we've now got a local industry for it, which is quite incredible. And from a really desperate need, we were able to keep our staff safe and also provide mutual aid right across the northern region. And beyond. A really inspiring story when at a time we felt incredibly vulnerable and incredibly helpless. And I think there are so many examples of that level of innovation within the NHS because of the fantastic response from staff and from communities and the partnerships that have enabled that to happen. So we'll never forget that support that we got from our communities, and I think it bodes well for the work that we wish to do in the future. As I said, when we launched Corona Voice in the first wave, we got a fantastic response, and we were able to normalise the highs and lows that came in each week. So that raise there was the week that we opened the PPE factory. People were feeling a little bit better and a little bit safer at that point. The nadir of week 11 was mask week. Anytime there was an announcement from the centre, I'd have to say that the scores took a bit of a dive, and that reflected some of the challenges that people were hearing around the information that existed in hospitals and then what was blaring through the TV at night. And sometimes there wasn't a consistency there, and that really unsettled our staff. So we were able to monitor this and normalise the emotional roller coaster that so many people have described. These were some of that we were theming the key concerns and feeding them through. As I said, these were some of the issues that people were really worried about, as well as learn and keep an appreciative eye on the things that people needed to keep going. And there's some of the positive things there for you. In September 2020, we'd come through the first wave, and I was really keen to repeat our health and well-being survey, because we'd done a health and well-being survey in 2019 at the very same time in September, and I wanted to compare our performance 1 year in after the pandemic, or at least the first wave of that. I was really surprised to see that health and well-being at this stage of the pandemic had been maintained. There was no material difference in our staff and well-being scores, nor was there a statistical decline in any of our sustainable engagement. People were still as committed to go above and beyond for the organisation, and still deeply proud to work for the Trust. So that was encouraging. There was independent research looking at the levels of staff engagement, and that link between staff engagement and how it's a predictor for performance. So this was work carried out by Listening into Action, which looked at all of the staff engagement and staff reported measures for support in the organisation, and how that could be used as a determinant for delivering in patient safety. And the Northumbria scores circled there in the top right hand corner, and leading the way in the NHS. But of course, this was early stories of COVID, wasn't it? We carried on measuring using Northumbria Voice. We stopped calling it Corona Voice because by this time we were convinced that the real-time platform needed to be embedded as part of our wider offering for staff experience. And actually we learned that statistical decline came in January and February of 2021. So Northumbria staff were able to hold their own throughout 2020, but it was the start of the year and what would have been our third wave in the Northeast that was most challenging. The blue line, interestingly, in the middle of the slide there, I've mapped mortality onto those, and that's because the mood in the organisation at times was palpable. And where we saw those peaks in mortality, it would be followed almost like a week later by a subsequent decline in the mood of the organisation, as people struggled to deal with both the volume, the emotional demands of the deaths on their wards, as well as losing a lot of their colleagues to sickness and absence, so trying to deal with capacity. And we really hoped to escape any staff deaths, but we had our first staff death in February, and it was particularly devastating for the organisation, and evident there in our results. So that told us that people were willing to use the platform in a very meaningful way to tell it like it is. We participated in the 2020 national survey results, and again, performed very well. So leading scores for staff morale, staff culture, team working and engagement, but coming from a group of staff who feel entirely comfortable about saying when things are less than good enough. So people feeling very, very happy raising concerns, confident that the organisation listens to the concerns of both staff and patients. And I think that was quite rewarding to see. So leading scores for the relationship between how staff felt about the Trust. And I can't prove it, but I do believe it was the Trust's courage to stay close to staff, really close to staff during the pandemic, that results in these relationship indicators here. It does take courage in the middle of a pandemic to be willing to broadcast loudly questions around asking people how they're feeling, because you can't always find a solution to some of those concerns, and managers and senior leaders were addressing fears and concerns of their own. But I'm really proud of the organisation for holding on to that, really. We've been able to use subsequent surveys to account for this statistical decline. It's not been a massive drop, and many organisations would be delighted with some of the scores, I guess. But it's a reminder for us that this is a time when staff are actually at their most tired, and that the emotional price, we measure emotional burnout and exhaustion. And again, the black stars indicating where we've seen meaningful change, comparing 2021 with 2020. And we were able, as I say, to understand that at a business unit, at a team level. These are all individual scores. And then that learning about how individual teams then informs the teams that we work with as part of our improvement programme. So we can understand which groups of staff are feeling the most challenged. And as I said, also understand with respect to groups represented by protected characteristics. If you go to any one of our hospitals, and we have 11 in Northumbria, this poster gets updated every 3 months. On one side of the poster, you'll see the latest patient experience performance. It tells you how recent patients have rated their care. We use SPC charts to track variation in real time. What patients have thought about their care in that particular hospital. And alongside that are the latest results of what staff believe it's like to work in that particular hospital. So really realizing our ambition that we had in the beginning, of bringing together staff experience and patient experience, measuring them well, measuring them consistently, and then reporting them widely, and using that information to inform our approach to quality and improvement overall. I started with Michael West's slide as quote as a favorite quote, and this would be another one that I really love. It's by a surgeon, Atul Gawande, and he reminds us about the fact that we often are working in this massively complex institution called the NHS, and it can feel like this colossal and impossibly complex machine. And so this notion around prioritizing human caring, stopping as an organisation to reflect on how do our patients feel in the moment, how do our staff feel delivering care at some of the most frightening times. It can seem the effort to simply do better, to listen, to understand, and to try and act on that feedback can seem hopelessly naive. But the results and the performance reported by Northumbria would suggest that that's not the case. So I'm going to stop here, Martine, and leave a little bit of time for questions, but I've got a request also for an evaluation, please. And it's quite a simple evaluation, and it's just a head, heart, takeaway and bin. So what have you learnt maybe that you didn't know before? That's the head bit. What have you loved about the presentation, if anything? And it's okay to say nothing. What will you take away to share with others? And then what do you recommend that Sol and I ditch from the presentation next time around? So if you can give us that feedback, we would really welcome it. But I'll stop. Sol, can you maybe share that link in the chat around the survey? And I'll stop sharing now, Martine, and just leave 10 minutes or so for questions.
Annie, thank you. Yeah. That'd be fantastic. Yeah, we will be doing an evaluation, so it'd be brilliant if everyone could please give some feedback on the session. Looking through the chat, I can see we have had a couple of questions already. So if I kick off with one that we had from Lou, and she asked, you're collecting large scale data. So how is the incoming data managed? And how do the reports go out to teams? What does that look like?
Okay. So the Ali Parkinson is full-time in my team and is managing the database as that information comes in. So it's quite a simple, straightforward database that records the performance of all the teams. So I'm wondering if you've got an example. Have you got an example to hand of a report that we can share? I'm just thinking of maybe one of the teams. Sorry to put you on the spot like that. Maybe you've got time to look for that while I carry on talking.
Yeah, no worries. Also, hello.
Yeah, that would be great. So it's shared in an electronic format across the business unit and to the specific teams. It will give them how they're doing against the trust average. It'll give a breakdown of the domains of the scores in each area. They'll get an idea of what sustainable engagement feels like for their team. And then we can also record all the free text comments if they want to read those well. Ali's a band 5 in my team. He's helped enormously by Sol in the team, and then we have others in the team that are whose main job is around doing the improvement workshops with teams and learning from the data to use that to improve.
Am I okay just to show the payroll report?
Yeah, go out. I mean, like I say, transparency at its best. I don't know what these results look like, so they won't be well, there you go, really low scores. So this was a team that we would have been working with. They get their scores out of 10 for that week in terms of how people are feeling. You see the distribution of scores and how that has changed over time. Can you just scroll down?
Yeah.
Thanks.
So this is just December to 2021.
Yeah. And then we also compare that with the Northumbria average, and they might get free text. The business units get quite detailed presentations of all of their staff, any statistical variation between teams, between managers, or learning around that, as well as the EDI information. So we share wider presentations, obviously, to board and our exec team and workforce committee, but this is an example of a kind of a team level report that you would get on a weekly basis if you were a team that were doing some improvement work.
Thank you for sharing that. It's really helpful to see. Lou said thank you as well. I saw an earlier question asking what platform or software that you use, and that also links to a question that's just come up in the box, and then saying, do you use the same system for patient and staff experience?
No, we don't. We use a different. So real time for patient experience and uses is a face-to-face conversation. We interview about 700 patients every month, and I'll obviously be going into the detail of this in the next webinar. And that's captured just on an Excel spreadsheet and shared in a formulated report. The platform was designed for staff experience. The platform was designed by Northumbria University PhD students. They call it Word Cloud. Again, not overly complex, but we've maintained that for our Northumbria Voice quick messages, the quick dives in. For the detailed pulse surveys, we use a platform, Oxford platform. It's a research platform. It's very similar to SurveyMonkey, really. It's the same sort of thing in terms of how it treats the data and translates it and reports it.
Thanks, Annie. Has anyone got any questions? I think I picked up the current ones in the chat. Here we go. Do you triangulate staff experience measures with other measures, e.g. you referred to mortality, and how do you prioritise what you extrapolate from areas needing intervention?
Yeah, so we started triangulating patient experience first. I think there's far more opportunity to do all together going forward, and importantly using AI to help us with that. But we do triangulate the data. So at a team level, patient experience is triangulated with patient safety data around clinical incidents, around falls, number of complaints, relating to the wards, as well as staff experience. So we understand that in the round, and make sure that it's not just one element that has gone off and a momentary blip, but actually is there a consistent picture across the trust picking up that this is a team in trouble for whatever reason, and patients have noticed it because they're complaining more, and staff have noticed it because they're unhappy, and that's impacting on patient safety and staff retention. So sickness and absence also in that. So we triangulate some key workforce data too. And I think it is the real opportunity going forward to have a much more nimble system to do that. We are doing that, but at the moment it's still quite clunky around the learning and the triangulation. I mean, I'm hoping in time with better support within IT that, and I know Kate Martin and Information is working on that, we will get very responsive reports at a team level that will enable us to do that at the click of a button, which will be exciting, but we're not there yet.
Thank you. I just look at Michaela's asked a question, which I guess you may well be picking up in the second webinar, which relates to patient feedback. Who and how do people engage with 700 patients for feedback?
Okay, so we have a team of real-time coordinators. So you remember our hospital site is pretty vast with 11 hospitals, but we have 4.5 whole-time equivalent, band 4 coordinators, patient coordinators, whose the majority of their work each week is to conduct those face-to-face interviews. And we do that across all of our wards, each ward getting at least 2 visits a month. Wards, care of older people wards generally might need multiple visits in order to get a reasonable amount before we generate a report. Our aim is to have spoken to at least 50% of patients with each ward visit.
Brilliant. Thank you. Has anyone got a final question for Annie before we start to round up this session? No, one final question from me, Annie. I wondered, now that you're collecting this patient staff data at scale, what impact it's had on the board and the discussions that they may be having at board level?
Yeah, completely. I think we've seen a sea change, really, Martin. I mean, Northumbria has been an organisation, and we've had a chief exec that's been quite people orientated from the very beginning. It's why we had our patient experience programme. But we had an exec away day, and I saw health and well-being of staff #1 on the agenda, and I thought, actually, I don't think I've ever seen that before in 10 years within the exec team. So these are conversations that are happening at board. There's great support for the programme from our chair, from our NEDs, real champions for that, and one of our NEDs with a particular eye on the development of IMT committee, really interested in how we integrate the measures and do that and use technology to support that. So I think without that level of senior leadership, we wouldn't have got anywhere close to doing that. And the other thing is they've also invested in the team. So they've invested in our staff experience program because it will be saving the organisation. There's a bottom line around staff experience, and it's costing organisations if we don't invest in it, and it's costing patients in terms of their safety and well-being, as well as staff in terms of emotional harm. So a very, very positive picture from the Northumbria board. I've left my details. I'll share the slides, Martine, with you, and I've left my contact details as well. We would be really, really keen to try and scale some of this work in systems across boards. So if there are organisations who feel they would have the support of their board and would like to get involved, then please do get in touch. But I hope it's been able to give you a flavour of some of the work, Martine, and hope it was what you had in mind.
Yeah, Annie, thank you so much for the session today. There's so much in that session, and thank you, Sol, as well. We have recorded it. We will be sharing the slides and Annie's contact details, as Annie has said now. This is core business to every healthcare organisation in terms of really understanding staff experience and making a difference. So thank you so much.
And critical to the recovery work, I think. We need critical work around the recovery, and we need measurement to understand how we're doing with that recovery process, I think. And please fill out I'm a feedback junkie. We are in this team. We don't turn up for any meetings without requesting feedback. So please give us it. It helps us get better all the time. So we'd really appreciate your thoughts on that too.
Yeah, no, that's great. Yeah, please, if everyone could complete the evaluation, and we will be shortly sharing the date for the second webinar in the autumn, probably September time, which will really look at that journey and focus around patient experience.
Yeah,
so
that's
really
a longer term story. It's a decade worth of work to share there, but hopefully I just wanted to start with staff experience today, because I think it's the most current issue and occupying all of our thoughts and concerns at the moment.
Yeah, there's plenty of food for thought there for everyone, and complements some work that is happening in Wales, how we can take it further forward, keep sharing what we're doing for improvement. But thank you so much, Annie. Thank you,
my
everybody.
Pleasure, and thanks to Sol for keeping me right. It would have been a technological disaster if I'd tried to do all of that myself. So
fantastic session, and some really brilliant feedback I can see going into the chat box. So thank you everyone for joining the session today. Thank you so much.
Take care. Look after yourselves. Bye.
Bye-bye.
Bye-bye.
Thank you. Bye.
Bye.
Thank you. Bye.